Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center on the coronavirus. Today is Thursday, May 14th. We begin by showing the graph that shows the number of cases of COVID-19 in the 8 counties of the capital region that are admitted to the hospital and that are in the ICU. As you can see on the grid, we currently have in those 8 counties 121 people who are admitted to the hospital. That's represented by the blue vertical bar. And we have 33 of them that are in ICUs, which is represented by the yellow vertical bar. There's a slight increase from yesterday. That's a number, Fred, that's very important when it comes to the county opening up or the region opening up. And so we're going to we'll pay close attention to that going forward.
Yep.
The next graph that we'll show is one that we've been showing over the last couple of days. It's a run chart that shows activity only inside here in the medical center. We currently have 50 people in the hospital that we're treating for COVID-19. We have 40 who are on either a medical or surgical floor. We have 10 of them in an ICU, and we have seven of them on ventilators. We'll talk a little bit about ventilators later on, Fred.
That's right.
But what's interesting is we don't see any people who have come in over the last 2 days who've tested positive.
That's correct.
So that's an encouraging sign.
Very encouraging.
We want to begin with some very serious information here about children and child abuse. I was contacted by Kaylin Dawson. She's one of our nurses who works in the emergency department, and one of her areas of expertise is child abuse. And she let me know that the number of cases that we have seen in the emergency department and in the pediatric clinics is actually down. Now that can be interpreted 2 different ways, but we believe that the reason why it's down is it's being underreported. And we believe that because we've read about that in other academic journals as well. Children are not in school, Fred. They're not being seen as much by other mandated reporters.
Right.
And so we believe that the observation of children of child abuse is down. We think this is a really important topic. We're speaking about this to the community because we think that if you see something, you should say something, and we all play a role in this, and we just wanted to talk about that.
We all do. This is very, very important to protect our children.
Yeah, and we thank Kaylin for bringing that to our attention, and we certainly will continue to talk about that going forward. We have some other information on children.
So Rebecca Butterfield, one of our pediatricians in our general pediatric practice, also is concerned about well-being of children. The number of well baby and well child visits is down, as is the rate of vaccination. Those are 2 very important things. Preventative care for the youngest and most vulnerable of our population is very important. So we should not be concerned about bringing those children in. Those are essential services. We're doing all the right things in the office, masking, screening our employees, screening patients, cleaning surfaces, all of the things to make it a safe environment. Please take care of this particular issue. And
those vaccinations, they are meant to be given on a regular cadence.
Absolutely.
And so we don't want to fall behind on that.
Very important.
If a parent is concerned about bringing their child in to the pediatrician, they should reach out to them and talk to them. But most importantly, we want them to keep that regular schedule.
That's right. Yeah. And Dennis, you have a shirt on.
Albany Med Kids is the location where we provide child care services to members of our workforce. It's been around since 1984. We have 163 kids enrolled in that program. We have an incredibly dedicated staff, and we want to thank them because they show up to work every single day, and they are caring for our children so our staff can care for patients. And so without that first step, we can't do the second step.
It's very important.
And we want to thank them, and we want to let them know that we appreciate all the great work they do at Albany Med Kids. And you're also wearing something today.
I'm wearing an information services shirt. And the other day we talked about clinical engineering, which actually is part of information services. And we also want to call attention to the other work going on. The analytics team, a lot of the data that you hear us talk about, the graphs, etc., comes out of the analytic team that's part of information services. And our ability to move people home, to work from home, also information services was key in creating that, and a whole host of other things that I won't go into. So shout out to IS.
Absolutely. One of the great things, Fred, about doing this video is members of the workforce reach out to us, and we both got an email from Wendy Casaval, and she said she'd been watching the governor's press conference, and she had heard that the mortality rate of people who end up on ventilators was as high as, I believe, 80%.
That's right, 80.
And she said she wanted to know how we were doing here at Albany Medical Center, and we have some good news.
We do. So Wendy, we've had 71 patients on ventilators. I'm happy to say that 33 of them have been extubated. 29 of the 33 are actually discharged. So 4 are still in the hospital. We have unfortunately had 30 who've died, and we still obviously have people ventilated here in the hospital. So, so our numbers at the moment look better than the state as a whole, probably at least in part related to the very, very fine care that we're giving those patients in our critical care units.
No question about it. Doctors, nurses, respiratory therapists,
the whole team, Dennis.
The pharmacists, everybody.
Team.
So numbers that we can be very proud of, the
Absolutely.
sickest of sick patients, and at least so far results that are better than the state average, and so we're very proud of our team. So thank you for that question. We are, as we mentioned, an academic organization, and weekly now we're having journal clubs. We mentioned that last week. Dr. Andy Coates organizes them. This week, the topic, interestingly, was the relationship between COVID-19 and neuro, the brain.
So this was just a fantastic journal club last night. 3 medical students covered a whole host of issues, from the physiology all the way through the clinical presentations. A lot of the clinical information is what I would call anecdotal, series 3, 4, 5 patients. But there's clearly a relationship between the lungs and the brain, and that's what the topic really focused on. One thing that was also discussed, Dr. Alan Boulos,
yes,
who is the chair of neurosurgery, he was the discussant. So after the medical students did their thing, Alan talked a little bit. And he showed some of our data, Dennis, which shows actually an increase in strokes that require thrombectomy, so large vessel strokes, that seem to parallel the increase in COVID cases over the past couple of months.
Interesting.
So there's been some of that talked about in the literature and even on the news. So very interesting phenomena. It was a really, really good conversation. And I think we actually have a message from Dr. Boulos to share with you.
We do, and Dr. Boulos is, as you said, not only a practicing neurosurgeon and the chair of the Department of Neurosurgery, he's also president of our medical staff. He's also actively involved in the faculty practice. He's also involved in COVID-19.
Very involved.
And he had a very important message that he wanted to deliver. His hope was to deliver it during Nurses Week, but we had so much activity, we said, can we do it this week? And it ties in perfectly to the fact that he did the Journal Club last night. So let's listen to this very important message from Dr. Boulos.
May 12, 2020 represented the 200th anniversary of the birthday of Florence Nightingale, and it was the last day of Nurses Appreciation Week. As a result, I wanted to reflect on the career of one of my colleagues, Pat Rapoli, who is in our 42nd year of employment at Albany Med. Pat joined us in the mid-70s and was a neuroscience bedside nurse taking care of patients who undergone modern neurosurgical techniques and witnessed the evolution of the medical care of stroke with intravenous TPA. And then she transferred to the angio suite as a procedural nurse in 2001, where she was at my side throughout the origins and evolution of neuroendovascular surgery, the treatment of ruptured aneurysms of the brain, and the treatment for ischemic stroke that is now performed in the angio suites. And she always provided a caring word for the patients and their families, which were in a state of fear due to the emergency conditions that they were facing, and a warm heart or a thoughtful gesture. In addition, she kept us honest. She always did a detailed neurologic assessment after the procedures, made sure I understood if things had changed, that we could rapidly intervene again and take care of our patients as best we could with the best outcomes possible. And she represents one of 5 nurses who joined us in the mid-70s. The other 4, Wanda McGowan, who still practices with us, and 3 recently retired nurses, Dottie Pickens, Donna Dibble, and Sue Edwards, who all started in the mid-1970s, established neuroscience nursing as a discipline within itself, detailed neurologic assessments in addition to what Pat brought to us, the thoughtful gestures, the kind words. But in addition, they had to offer tremendous patience for our patients. These neurologically injured patients often recover very slowly. It's frustrating for the patient, frustrating for the families, and they stay day in and day out at their bedside, encouraging words to all involved. And it makes me think now of how important that patience is. With the New York pause, with the quarantine, with everyone getting on each other's nerves within the houses, patience is really a most important virtue, and they demonstrated that in spades throughout their career. And in summary, the 5 of them provided 206 bedside nursing years in total, exceeding even Florence Nightingale's theoretical age. And so it's a gift that they've given to us and to the community at large, and it's a chance for us to remember that and thank them for it, and to realize that their origins have allowed for us to continue that culture of excellence, and that the current neuroscience nurses provide the utmost care, the same detailed neurologic exams, and that compassion and caring and patience that I described of the other 5. Thank you.
All right, thank you, Dr. Boulos, for that really inspiring message, and thank you to the nurses that he spoke about for all the incredible care that you've given here for so many years. Fred, we have a couple of really good topics we're going to talk about tomorrow.
Tomorrow we're going to talk more about research, and we're also going to talk about our serology testing. So we'll have more information on that tomorrow.
All right, look forward to it. That's it for today. We'll be back again tomorrow. As always, we ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.